Tonight, I'm very happy to be able to share a rather special experience when logosynthesis meets medical imaging. My name is Mélanie Sarbach. I'm a medical imaging nurse and a logosynthesis practitioner and instructor for a few days now, since a few days. So I'm going to talk today about what happens when these two words meet. This is the Medical Imaging Center where I work. It's in Mimizan, west coast in France. A part of my job as a nurse is to welcome patients, check if they are eligible for the examination. I have to install them, and sometimes I insert a catheter and also I monitor them after the examination. I was hired to work in collaboration with the radio manipulator. Everything starts with the radiologist. One day we were talking, and it was a casual conversation. And she asked me why I was there just for 3 days in the week. And when I told her about my other job as a therapist in my private office, she said she never heard about logosynthesis, of course, but she said, okay, if you want to try something one day, well, just try. And you just have to take care. Do not disturb the flow of the day. But, well, try it. Okay, so this same day, a lady came. She was 52 years old. She was with her mom and panicked. Really, it was very difficult for her. She was here for the fourth time, and every time, the moment she was at the door of the CT scan room, she just couldn't. She was, how can I say this? Every time she was at the door, she saw her grandmother's coffin being placed in the crematorium oven. And, well, it was a traumatic memory for her. So we have a small session of logosynthesis, and she managed to get through the scanner. My colleagues thought, well, this is a miracle. And this day, it was kind of miracle. When I work in this center, I'm in a specific therapeutic field. Because in medical imaging, the time frame is very short. We are in a medical environment, which is very different from my private office and this cozy place when it's my place. The stress level is very high, but we have also a very clear objective. People want to have a diagnosis. They need to have this diagnosis. So the motivation is very high. And from a logosynthesis point of view, this environment, this is an environment of maximum activation of survival system. So I call this slide Under Pressure. And I wanted to show you that the pressure is a shared reality. Patients experiment fear, guilt, shame. For them, it's like a loss of control. They're feeling trapped, not being capable. And they experiment claustrophobia, panic attack, cancel exam, and delayed diagnosis. And for the team, we also have pressure with time, scheduling, sometimes technical issues, frustration, helplessness, and the most of the time, misunderstanding. And we do not face only claustrophobia. Sometimes patients have medical trauma, like they experimented a situation when they were child and with a lot of possible trauma. We may have experiences of long-term illness. We may have fear related to death or diagnosis, projection onto the machine. What if the machine stop? And also beliefs. Heart is dangerous, MRI is serious, but I will talk to you about this later. Of course, in imaging, we already do a lot. We try to reassure patients, we try to explain, and we know that when people know what is going on, sometimes stress decrease. We take our time. Sometimes we offer medication, but it may also be a problem because in that case, people can't come by their own. They have to come with someone. They cannot drive. And of course, if necessary, we can postpone the examination. And yet, despite all of this, some people remain stuck. Not because they don't want to, they just can't. When an examination cannot be performed, it's not just a missing appointment. It's a patient who lives without a diagnosis. It's a wasted machine slot. It's staff mobilized for nothing. And often it's several more weeks of waiting for the person. So there is a clinical and human issue, but also an organizational and economic one. And it's in this very concrete context that logosynthesis entered the center. It's not there for ideological reasons. It solves a real problem. And what is very interesting in that, it's that what is good for the patient is also good for the medical system. What about logosynthesis? It's a brief language-based approach. It is based on a very simple idea. What causes us suffering today is not the current situation, but a trigger that activates old information. It clearly distinguishes between two things: the reaction, what I feel, what I think, what my body experiences, and the trigger, the information that triggered this situation the most of the time in the past. In logosynthesis, we do not seek to calm the reaction. We deactivate the trigger. And when the trigger is deactivated, the reaction no longer has any reason to exist. And this is exactly what is valuable in medical imaging. We don't have time to do therapy. We just need to deactivate the trigger. I thought it was interesting to look at the lexicon of logosynthesis. In this lexicon, Willem Lammers writes, fear is a vital and necessary response to a threat. It mobilizes your system to protect you. And that's why logosynthesis works here. It does not fight fear. It acts on the trigger, works in the present moment, and restores the system's regulation. I wanted to talk to you about another case. Mrs. D, she was 60 years old. She wasn't claustrophobic, but she was unable to remain in the MRI machine. Every time she entered in the MRI machine, her body panicked. When I listened to her, an experience emerged, a near drawing in her childhood. Her body was not reacting to the machine, but to a memory of suffocation. And after we met, it was okay for her to go to the MRI. What we did in 20 minutes, we create an alliance, and for me, it's the more fragile point. I don't have time to talk with patients. Patients don't have time to tell me their story. And well, we just have to be together. And after that, I think that activation and motivation create an alliance. I have to calibrate the reaction, and this is a very important point. I ask patient to the stress of the level of stress on a scale from 0 to 10. I ask for the body reaction, for the thoughts also. After that, we have to identify the trigger with questions. Then we use the targeted sentences of logosynthesis. And after that, we check for stress reduction. And at this point, patients may acknowledge that stress just reduced. We don't need to, they don't need to relieve the scene. I don't need to analyze it, and we don't need to force it. I wanted to talk to you about another case. Mrs. C had to go to a choro scan. And the problem was that few years ago, she already did it, but after the choro scan, she had to stay in intensive care because she developed a tachycardia. And the doctor thought it was the high level of stress who did the tachycardia. Um, what she told me that when she was 13 years old, her father just died from a heart attack, but a few years later, another member of the family, and then another one, and another one. So for her, the heart was dangerous. And heart is dangerous were his exact words. So we used the logosynthesis sentences on these beliefs, and it was okay. She just go to the coroscan, and well, it was fantastic for her. I told you about success, but this story is also a challenge for me. The medical field is about security, about protocol, about strict framework, and that's normal, of course. Logosynthesis, on the other hand, works with invisible energy, presence. So bringing these two worlds together is not easy, was not easy. I have to say that I worked a lot about my own legitimacy, about my posture, about my expectation or others' expectation. But today, I think logosynthesis has proven itself and on its own terms. So, what I observed today, um, exams conducted under good conditions and for patient and caregiver, because going through the exam is not the only problem. You have, if I may say, good and bad exam, and we need patience, calm patients, and they have to stay still. So this is also helpful for us to work with logosynthesis. Patients are calmer and more present, but team are also more relaxed. And um, I think I saw about 70 patients in this past year, and only 4 of them didn't go to the MRI or the CT scan. So it's a very, very successful procedure. And what I observed too is that the changes seem lasting. I don't have a lot of return from the patient, but when they do, the shift continue in their current life. So I think that this only small moment with logosynthesis is enough to yes, to help patients for the rest of their life, maybe, I hope. Um, Today, for me, logosynthesis is no more separated from care. And it's more an evolution of it. And I think it's where body, memory, and present meet. Do you have any questions?